growing up, my grandfather told me that people could fly. I thought in some way he was trying to tell us that we could do anything if we put our minds to it. And then he told me to look up. And when I did, all I saw was blue sky. And then he asked me if I could see them, and I couldn't. We learned later that my grandfather was a sufferer of schizophrenia. What we thought was just a vivid and colorful imagination turned into be a debilitating disease. Throughout this speech, I will help you gain a better understanding of schizophrenia, what causes it, symptoms, and who it affects, and lastly, what you can do to help somebody who may be exhibiting signs of this illness. The term schizophrenia is derived from two Greek words, schizo and phrenos, which means shattered mind. A shattered mind describes the illness to a degree, but it doesn't completely capture the details of what this illness really is. Schizophrenia is described as a chronic, severe, and incredibly debilitating disorder that has affected people throughout history. Currently, it affects 1% of the American population. Now, a person living with schizophrenia is likely experiencing several symptoms. These symptoms fall into three main categories. The first category are positive symptoms. Positive symptoms are the psychotic behaviors that are not seen in healthy people. People who suffer from this disease often lose touch with reality. These symptoms can come and go, be severe, or sometimes even be unnoticeable. One symptom in particular is hallucinations. Hallucinations are when a person sees, hears, feels, or smells something or someone that no one else can see, hear, feel, or smell. Hearing voices is also very common, and these voices can give directions or even talk to one another. Delusions are also common. Sometimes people with schizophrenia believe they are someone else, or maybe that someone is watching them or broadcasting their thoughts to everyone. People with schizophrenia are also very paranoid. They can also think people are out to get them, trying to hurt them. They experience dysfunctional ways of thinking and have agitated body movements. The second type of symptoms are negative symptoms. These have to do with behaviors and emotions. These symptoms are harder to notice and can easily be mistaken for depression or other conditions. These symptoms include a lack of pleasure in everyday activities, the inability to sustain planned activities, and speaking very little, often even when forced to interact. The third and final type of symptom are cognitive symptoms. These are usually subtle and may also be difficult to recognize. This includes trouble focusing or paying attention and problems with working memory. Now, many of you may be wondering, how does somebody end up with a diagnosis of schizophrenia? What causes it? Well, science has shown that this disease runs in families. While this disease occurs in just 1% of the population, it occurs in 10% of people who have a first-degree blood relative with the disease, such as a parent, brother, or sister. People with second-degree relatives, such as a grandparent, as in my case, uncles or cousins, are also known to develop schizophrenia more often than the general population. The risk is greatest, however, for an identical twin of a person who is suffering with the disease. They have a 40 to 65% higher chance of developing the disorder. Because we get our genes from our parents, scientists believe that general genes are associated with an increased risk of schizophrenia. However, no one gene alone causes the disease itself. Environment can also play a role. Scientists believe that exposure to viruses, malnutrition in the womb before birth, problems during birth as well can be factors. Schizophrenia affects men and women equally, and it occurs in similar rates in all ethnic groups around the world. Symptoms usually begin at the age of 16 and to 30. And men tend to experience symptoms a little earlier than women. Teens in particular are incredibly hard to diagnose because their behaviors that are common among teens, such as a change in friends, sleep deprivation, grades dropping, are the same symptoms of schizophrenia. Now, once somebody has been diagnosed accurately by a medical professional, there are many things you can do to go about treatment so that those symptoms can be managed. Oftentimes, however, people with schizophrenia resist treatment because in their minds, what is happening and who they are is real to them. In this case, it's imperative to have family and friends take action to keep that person safe. That could mean hospitalization, that could mean having an intervention. Antipsychotic medications are available and help to relieve and treat psychotic symptoms and hallucinations. While it can be difficult to know what to do when someone you love is diagnosed with this illness, your love and support and respect, all while not tolerating any violent or dangerous behavior, will always be the best way to approach someone who is struggling with this illness. My grandfather's illness taught me so much. Fortunately for us, our experience was very easy. What I can say is while some may have thought he had a shattered mind, he was far from fragile. He was one of the strongest people I know. Thank you.